Since his arrival at Duke in 1977, 3 years out of Medical College of Ohio, John Perfect has established himself as a leading international investigator in mycology, the study of pathogenic fungi that affect humans. He is best known for his work with the potentially deadly pathogen called Cryptococcus neoformans, which he helped to bring into the international spotlight. It affects nearly 1 million people worldwide annually and is attributed to nearly 700,000 deaths.
It is an organism that causes significant central nervous system disease, particularly in the southeastern part of the United States, and in fact the most common cause of central nervous system infection that we see at Duke Hospital. That has been amplified over the years when the HIV pan-epidemic occurred throughout both the United States and other areas of the world.
Usually I show people John's textbook. He literally wrote the textbook on Cryptococcus neoformans. And I have a copy of it right here, published by the ASM Press, and he co-wrote this book with Arturo Costaval, who's the chair of microbiology and immunology at the Albert Einstein College of Medicine.
With all these fungal infections, that if we can get to the infection early enough, we can use the antifungal therapies that we have a pretty good chance of clearing and curing these type of patients.
Dr. Perfect is the lead author of guidelines for the treatment of cryptococcal diseases that recently were issued by the Infectious Diseases Society of America, and is a much sought-after invited lecturer around the world.
Everyone loves to interact with John at meetings because when you're speaking with John, you have his complete undivided attention.
What truly elevates Dr. Perfect to a higher status of physician-scientist is his deep passion for mentoring young faculty, house staff, and students, and his genuinely caring bedside manner with patients.
That kind of emphasis on excellence and the ability to be obsessive, compulsive, to be committed to the care of the patients is something very, very attractive to me, and really continues to shape my career.
I have one story to tell about John that I really like, about a patient that he saw one day, and he came into the room and was going to start the interview, and the patient looked up and said something along the lines of, "I found you. I finally found you. I've looked everywhere for you, and now I found you. Dr. Perfect, the perfect physician." And I think that really sums it up very well. That is exactly what John is. He is the perfect physician.
An average day for Dr. Perfect includes visiting nearly every member of his group and asking about their research and helping them to brainstorm solutions. Observers say it is clear that he deeply believes in the individuals he mentors.
He is a very caring practitioner of medicine, but he's also one of those key individuals in the medical center here that makes this such a special place.
It was absolutely critical that I did this kind of work at a place like Duke. We are pushing the envelope. We are at the edge of clinical practice. We push the underlying diseases to keep these patients alive for a long period of time, past the time that maybe some of the other places could not keep or support the patients.
Through all of his professional accomplishments at Duke, Dr. Perfect has remained a devoted husband and father to 4 children.
His wife, Becky, was a nurse for many years, and now she also works in the medical center. He has 4 children that he's very devoted to: Zach, Tyler, Chase, and Chelsea.
I give the most credit in my career to my wife. The 30 years of doing research, of seeing patients, the nights that I'm not there. She's always been the person that kept the family together, always the person that was there, taking care of me, taking care of the kids. For me, it was absolutely essential, and she should be given significant credit for that.